Hey, welcome back, welcome back, welcome back, welcome back, welcome back. Obviously, somebody's been on TikTok too long, but welcome back to my channel. And today we will be talking about psychiatry. So psych, I was lucky enough to have psych as my first core rotation. I think it's a really good start, and people from Ross, they go to a thing called Internal Medicine Foundations, which you'll see a video about beforehand. And basically what that is, it's at Cleveland Clinic and it's for 6 weeks. Now it's 8 weeks in which you become acclimated with the hospital environment, and it's basically an internal medicine rotation, as well as getting practice with step 2 CS and OSCE cases, where you have a patient that you're going to go see in the office, and they have a room set up just like an office, and you have to go to each room and talk to the patient, figure out what's wrong, giving them multiple diagnosis and possible treatment options. So that's basically what IMF was. But even after I did IMF, I did a community medicine elective, which also helped me become more acclimated to the hospital environment, even though it was outpatient. But it was more about being more comfortable with talking to patients who are actually not actors. So that was really good. And I did that for 4 weeks prior to starting my actual core rotations at Atlanta Medical Center. So let's get into it. I will be talking to you about my experience during the psych rotation, as well as how I studied for the shelf, okay? So my experience with psych, so let me tell you. So what's really funny about psych is I thought that I wasn't gonna like psych and just get me out of here, you know, because let me tell you, so we were at orientation, right? And so not my attending, but the person that was giving us the tour, who has been working at the hospital for years, he's like a case manager or a psychologist. But he wasn't my attending, but he's been there for a really long time. So he walks up, he goes, yeah, so this is the hospital ward, and make sure when you come in that you put your badge in, and when you turn around, make sure the door closes behind you before you go to the next door. And when you go to the next door, make sure that there's nobody coming in or behind you. Then you want to swipe your badge, and after you swipe your badge, you're going to make sure the door closes behind you. And you know, you want to always keep this stance, you know, be aware of your surroundings at all times, because you know, I have my leg broken at least 3 times in the same leg by some psych patients, and I'm just sitting there like, do you see this? Do you see this? Nothing. I barely have meat on my bones, and you start talking about somebody broke your leg 3 times in the same leg. So when I tell you, I was so scared. I was like, man, they gonna break my leg. They gonna break my leg. I'm too small and I'm so scrawny. I look like I'm 12. Like, I was on the phone with my parents like, oh my gosh, I don't know I can do this. I don't know I can do this. And they were like, Sherry, calm down. He's just telling you to be cautious. And that's basically what he was, just to be cautious and be completely aware of your surroundings at all times. You know, how a person would, quote unquote, usually respond, they're most likely not going to respond that way. So it's just a different way to conduct yourself in a psych ward than you would do on internal medicine floor or in the ICU or a surgery floor. So it's just a little different. But after I had the phone call, my parents were just like, girl, you better get yourself together, get it together. And I was like, you know what? I got this. After the first day, I was totally fine, and I ended up really liking psych. Psych went really well today, and I was pleasantly surprised. Like, people usually, like, you would think
that, I mean, it's just so many like genetical predisposition, the stories behind why the patient is there. It's just, I mean, sometimes you have to just reflect on your own life and just be grateful, because some people don't have resources, some people don't have family, some people had trauma that has predisposed them to whatever diagnosis that they have. Some people just don't have the resources, and being able to work with the counselor and the social worker, as well as my proctor, all together trying to figure out the treatment plan.
Don't get me wrong, like psych is really hard and it can become like extremely taxing. So I'm not saying that, I'm not trying to take that away, but it can be very rewarding, and getting to know your patients and spending time with them can be very rewarding too. So, anyways, I have errands to run, and I'm on call this weekend, so I have to go. Like, I really liked psych. Psych was so much fun because it was just, because with psychology, people who have psychiatric disorders, a lot of it is shunned in the media, as well as specific family dynamics have also shunned it. I know it is really shunned a lot in the minority population, especially in African Americans. They don't really tend to understand or fully understand the psychiatric disorders. So, because I was on 2 floors. So the first floor was the geriatrics, and the second floor was just for adults. I didn't do any children's psych. So that was also interesting as well. And just to see how intricate that my attending worked with the people was really amazing. Like every day, so we go see our patients. It was 3 of us, and we would go see our patients. I highlight the patients I had, they highlight the patients they had, go talk with the patients, and then after that give them updates. And then after we would go see them, we would also speak with our attending, as well as the case manager and the social worker. So every day at like 10 or 11 o'clock, we would meet in this room where we would have the social worker, the attending that was for that patient, as well as the case manager, and if there was hospital administration that needs to be there. So I really like the teamwork aspect, because everybody was able to say, like, patient X, Y, and Z will be possible readily for discharge, but he needs placement for housing. And the social worker would be like, I have spoke with such and such housing, and they will be able to take him, as well as provide follow up at a specific hospital that will take his insurance, so that he can have follow-up, as well as a place to stay, to make sure that he has some type of stability in his life. So I really, really, really enjoyed the teamwork that came with this psychiatric ward that I was in. And I also really liked the patients, because yes, their psychiatric disorders are part of it genetic, but some of it is also environmental. So I don't know if everyone knows that, but it's not all about genetics. You could be highly prone to getting a specific psychiatric disorder, and then say, for instance, you wanted that a patient tried a specific drug and then they had their first episode. So it's like a lot of different things that go into psych, which is also just not genetics, but it's environmental and things of that nature. And I really enjoyed it. And psych has no discrimination. It affects everybody, all ages. It doesn't matter what you look like, how much money you make. It affects everybody. And it was just really interesting to see how it was not only affecting the patients, but also the patients' family members who were having a hard time with the diagnosis, or simply just didn't believe the diagnosis, even though the patient was in and out of, the psych ward. A lot of things were blamed on substance abuse, even though their person may not even been using substance abuse. But it's very, very, very good. I really liked psych, if you cannot tell. But for my psych was 6 weeks, and one was outpatient and the rest was inpatient. I like the outpatient, but I prefer the inpatient because I was able to see more patients, and it wasn't as much as prescription refills. I really got to understand how the teamwork. Well, it just wasn't one person seeing patients. It was the social worker, the hospital administration, the attending that takes care of it. Just a really huge teamwork, and that's what I really like. That's what I really liked in psych. So with psych, the psych shelf was actually very, very straightforward. I think there's maybe like one or two things that kind of popped up randomly on the shelf exam, but a lot of people forget psych also includes neuro. You have to know neuro because you will get a question on that shelf exam that's going to have a picture of a brain. It's going to ask you big brain, frontal lobe, things of that nature. So don't forget your neuro. A lot of people forgot about that and they did lose points. I actually didn't have that much neuro as some people did. Some people had like 50-50 where they had neuro and psych, or more versus myself. I had very little neuro, but I had psych and a lot of psych drugs. And a lot of people like to shy away from psych drugs, but it's really not that many psych drugs. And the thing with psych drugs is when you're in the wards, because like in certain other rotations, they'd be like, well, you could use that. Yeah, that's what the book says, but we don't really use it. We don't really use that. We use something else. Psych is, you use it, what you see in the book is what you see in the hospital. It does not change for the most part. Like, so I say like 80% of the time, it does not change. So that's one thing that I really liked, because when you're new and you're trying to learn different things and you're like, so you're one of the residents or one of the attendings like, oh yeah, that's a great option, but we're gonna use something else, and you're just like, okay, so I gotta remember that too. Like so psych just made sense. It just made sense. So for the shelf exam, like I've said, this is all you need plus UWorld. This is a very easy read. One of my friends who graduated from medical school actually gave me this book, and it's literally 190, 200 pages, but you could literally finish. I read this book twice, and I did UWorld twice. Like I said before, with UWorld, go through the questions, tutor mode, mark all those questions, and then redo the mark questions so you can go through UWorld twice. Don't tell anybody that. They were like, you're supposed to reset it. No. So do those questions, mark. Then after you do that, make sure you review your psych as well as the neuro. I use my step 1 book to review my neuro portion, as well as some of the slides that my neurology professor provided during basic sciences, as well as Sketchy Farm for Sketchy Psych. So those were the 3 things that I did, as well as do all the NBMEs. I always say do all the NBMEs because you want to max out on all your questions. You want to be doing think psych on UWorld was maybe like 200 questions. And then, so you do those 200 questions, and NBME is that, I think it was 4 NBME. So that's another 300, 400 questions. And then you go through the marked ones. And then of course, after you do that, you watch Emma Holiday Psych, as well as Da Vinci Psych. And then that's basically it. Psych is very, it's straightforward, but it's not straightforward. But as far as the book portion is very straightforward. Psych was actually one of my favorite rotations, as well as one of my highest grades for a psych shelf, and I did get an A in psych. So I'm trying to think of anything else in psych. Yeah, I would just say, you know, be confident, know that you're there for a reason. Don't be nervous because it's in a different environment. Be
conscious
of everything in your surroundings, just like how you should do in everything else. You should always be conscious of your surroundings. That may take a little bit of time to get used to, but once you are in and you're dealing with patients, it's really nothing to it. So I hope you liked the video, and don't forget to like, subscribe, and comment. And I'll see you back for another video. Bye.